Mirena insertion and placement is easy to master and takes only minutes to perform. The following animated Mirena insertion technique, in combination with the live insertion, is intended to help you gain a greater understanding of the Mirena procedure and to help ensure successful placement of Mirena. Additionally, trained representatives are available to introduce and refresh you in the proper insertion of Mirena. Furthermore, continuing medical education insertion training is provided. Remember, Mirena should be inserted by a trained healthcare provider. Healthcare providers are advised to become thoroughly familiar with the insertion instructions before attempting insertion of Mirena. Prior to insertion, confirm that the patient understands the contraceptive method, intrauterine contraception, and the alternatives. Additionally, that she has read and signed a copy of the patient consent form and that all her questions have been answered. Also, confirm that all previous tests are negative and there are no contraindications to the use of Mirena. Perform a urine pregnancy test as well. As you prepare to insert Mirena, you should perform a bimanual exam to establish the size and position of the uterus, to detect other genital contraindications, and to exclude pregnancy. And, as with other medical procedures, ensure use of sterile technique throughout the entire procedure. With the patient comfortably in the lithotomy position, gently insert a speculum of appropriate size to visualize the cervix and rule out genital contraindications. If necessary, continue to open the blades of the vaginal speculum to adequately expose the cervix. Grasp the lip of the cervix with a tenaculum forceps and apply gentle traction to align the cervical canal with the uterine cavity. The tenaculum should remain in position throughout the insertion procedure to maintain gentle traction on the cervix. Gently insert a uterine sound to determine the depth of the uterine cavity, confirm its direction, and exclude the presence of uterine anomalies. If you encounter cervical stenosis, use dilation, not force, to overcome resistance. The uterus should sound to a depth of 6 to 9 centimeters. Mirena is now ready to be inserted. While maintaining traction on the cervix, gently advance the insertion tube through the cervical canal and into the uterine cavity until the flange is 1.5 to 2 centimeters from the cervix. This position allows for sufficient space for the arms to open when released within the uterine cavity. Now, while holding the inserter steady, release the arms of Mirena by pulling the slider back until the top of the slider reaches the mark, which is the raised horizontal line on the handle. It is important to wait to allow the horizontal arms of the Mirena to open completely and regain its T shape. This wait time is necessary for proper placement and fundal positioning. Now, gently advance the inserter into the uterine cavity until the flange meets the cervix and you feel fundal resistance. Mirena should now be in the desired fundal position. While holding the inserter steady, pull the slider all the way down to release Mirena. The threads will release automatically from the cleft. Check that the threads are hanging freely. Then gently withdraw the inserter from the uterus. Be careful not to pull on the threads. Now, using sterile curved scissors, cut the threads, leaving about 3 centimeters visible outside the cervix. Measure the length of the visible threads outside the cervix, for example, with the use of the centimeter scale of a uterine sound. The length of the thread should be recorded in the patient's file for comparison during follow-up visits. Mirena insertion is now complete. Please refer to the live Mirena insertion procedure for more information.